It's in your hands. Up to 50% of all cancer deaths are said to be preventable by keeping an eye on the typical risk factors, not an insignificant number. In reality, precisely our everyday habits are the factors that can promote cancer. Cancer is the second most common cause of death after cardiovascular disease, typically heart attacks. It can unfortunately affect almost all of us sooner or later. In other words, it can be basically said that none of us is protected from this. This figure is not intended to be scaremongering, but it is unfortunately a fact. This makes it all the more important to know about this and to try and reduce this risk. Just like you probably are, I'm also really scared of being diagnosed with cancer at some point in my life because, as I said, you simply cannot completely protect yourself against such a disease, complex diseases. We don't know enough about it yet. However, and this is the crux of the matter, perhaps also the main point of this video, we all can actually reduce our personal cancer risk. We can reduce it by avoiding as many risk factors for cancer as possible. In other words, by reducing our exposure to the causes of cancer, so to speak. And then the second thing that is also important is preventive medical checkups. There are types of cancer that you can't protect yourself against, and you really are just unlucky if you get them. But there is cancer that can be prevented, and many types of cancer can actually be prevented, or they can be detected relatively early with screening tests, and if they're detected early, they can be treated relatively easily. I would now like to introduce you to the 5 most common causes of cancer that can be potentially prevented, so pay close attention. This video is really important. Hello, my name is Dr. Tobias Wegel, and with my YouTube channel, I would like to provide medical, understandable, and correct information about diseases, the causes of these, and what we can do about them ourselves, including preventive measures. And if you don't want to miss anything, then subscribe to my channel now. The number of cancer cases has been rising steadily for decades now. Of course, this has something to do with the fact that the average age of the population is rising. That is one factor. This is because the probability of developing cancer naturally increases with age for many types of cancer. Admittedly, this is a factor that we cannot influence. We want to get older, we can't stop it, but this increases the risk of cancer. But did you know that cancer is diagnosed more frequently in economically strong regions around the world? One of these examples is us here in Germany. Of course, it has to be said that this may also be due to the fact that countries like Germany have more diagnoses in general and also a better early detection. MRI, for example, is one example of how cancer can be found early or through preventive examinations. However, current research also assumes, and this is important, that many lifestyle factors typical of industrialized countries are all partly responsible for the development of cancer. This includes factors such as fast food, lack of exercise, stress, hectic pace, lack of sleep. The WHO even assumes that between 30 and 50%, so in other words, really a lot of cases, could be prevented by avoiding the most serious risk factors. Up to half of all cancer deaths, think about this and let it sink in a moment. And that really is a lot of cases, so we actually have it partly in our own hands. We can actually prevent cancer ourselves. Before I tell you exactly what these most common risk factors are, it's really important for me to emphasize that I'm not trying to put blame on someone here. I hope that's quite clear. Something along the lines of, you have lung cancer, it's probably your own fault because you smoked. I don't want to say that. There are also plenty of people who have never smoked a cigarette in their lives and still develop lung cancer. And people who live to a ripe old age, supposedly healthy, with a cigarette in their hand. And even if smoking or whatever else was the cause, the patient should not be blamed for it. That is very important for me to say again. At the end of the day, we shouldn't underestimate stupid chance, and we should neither underestimate our genetics. Nevertheless, we have a lot in our own hands. And I'm going to go into this topic now to sensitize you to it. Try to at least reduce your own individual risk of developing cancer. Influenceable and non-influenceable risk factors. As diverse as various cancers can unfortunately manifest themselves, the trigger is basically always damage to our genes. In principle, that is the decisive factor to focus on. Cancer is, so to speak, the own tissue that grows uncontrollably. Damage to the DNA leads to uncontrolled cell growth and the displacement of surrounding healthy tissue. A space-occupying lesion develops. That's what it's called. But how does such DNA damage occur? What triggers it? It is currently assumed that it is often the interaction of various risk factors. Not a single factor is responsible by itself. And risk factors can, of course, greatly increase the likelihood of cancer. That's why they're called risk factors. But that also varies from person to person, so there is no definitive statement possible. In many patients, it is no longer possible to trace back what ultimately triggered the disease. This also has to be said. Sometimes it's just the last drop that has made the barrel overflow, so to speak, but the barrel had to be filled first. However, it is clear, and I think it is important to emphasize the following. There are risk factors that we can avoid and other risk factors that we sadly cannot avoid. The two most unavoidable factors so far are probably certain hereditary components and age. Another factor that we cannot influence is simply chance, or in other words, bad luck. But other factors can be influenced more effectively. And that's what I want to talk to you about in this video. Because number one, smoking. Smoking is probably not a surprise winner, but I actually have to mention it here now. Why is that, you ask? Because more people are smoking again. Tobacco consumption causes at least 19, in other words, almost 20% of all cancer cases in Germany. This is a very high number, and thus smoking occupies the sad first place among the most preventable risk factors. Another important point here, smoking not only increases the risk of lung cancer, but also, for example, laryngeal cancer, pancreatic cancer, and also for certain forms of leukemia. Also bladder cancer. The way for you to avoid this risk factor is quite obvious in this case. You will have to stop smoking. Unfortunately, it has to be said, passive smoking is also massively harmful. Unfortunately, depending on the circumstances, you may have less influence over this factor yourself. Especially when, as was often the case in the past, there were children in the same room. Of course, this also has an impact on health, on the risk of cancer. Back to the topic of changes to the DNA. Once again, I repeat another point in general before we move on to the next avoidable cause. In general, the earlier the cancer is detected, lung cancer, other types of cancer, the higher the chances of survival and recovery in the vast majority of cases. So, regular checkups are very important for the early detection of cancer. But what is also essential is that you are also able to recognize early signs, the first signs, of the various cancers. Noticing, realizing that there is a change, and unfortunately the symptoms are often unspecific at the beginning. Typically, for example, weight loss that is not planned. It is said that more than 10% in the last 6 months is alarming. Sweating a lot at night, feeling very tired and fatigued are also symptoms. To make sure you don't make this mistake and mistake these symptoms for something else, I have already created this video for you. You are welcome to take a look. But now let's move on to the next factor, because that's what we're talking about now, which you can influence yourself. Because number 2, an unhealthy diet. Yes, that brings us to the next point. I also like to preach it very often in my videos. An unhealthy diet is a risk factor for many diseases, and cancer is also one of these diseases. What is an unhealthy diet? I'll tell you in a moment. An estimated 8% of cancers, which is a big number, are caused by fatty, highly salted, and super sweet foods. In other words, they are caused by sugar and industrial sugar. Similar to smoking, several types of cancer can be influenced by diet. In addition to cancer of the digestive tract, these include prostate and breast cancer and others. Of course, genetics also play an important role. But the focus is particularly on the excessive consumption of red meat, highly processed foods such as the majority of ready meals. Sweets, soft drinks, and the like are also being focused on a lot lately. And always very important to say, you consumed all that years ago already. If you get cancer breaks now, it is not the result of what you have eaten in the last few weeks, so to speak, but what you ate years ago. Another example would also be sunburn and skin cancer. Here, the main risk factor is actually that you were often sunburned as a child. The same principle applies to nutrition and diet. So, an unbalanced and nutrient-poor diet is also considered a risk factor for developing cancer. The moral of the story is clear. Eat colorful and healthy, colorful and crunchy, include vegetables in your diet. Sufficient vitamins, minerals, and above all, so-called secondary plant substances are essential for cancer prevention. The German Nutrition Society recommends at least 400 grams of vegetables and 250 grams of fruit a day. But it is also very important to mention, as studies show, that people often think they are eating healthily and have a balanced diet, but in reality they are not. Cause number 3, being overweight. According to calculations, at least 7% of all cancers in Germany are caused by obesity. And here you can already see how the various factors are also interrelated. Before this point, we talked about unhealthy diet. The International Agency for Research on Cancer has also published about this. It sees a link between at least 13 forms of cancer and excessive body fat. This includes liver cancer, for example. First comes the fatty liver, then liver cancer. Kidney cancer, malignant tumors in the male and female reproductive organs. There is also an increased risk for that with obesity. Of course, it has to be said quite clearly that the connection is not equally strong for each of these 13 types of cancer. And here too, various factors play a role in the development of cancer. Sometimes there are also other risk factors, or several factors that come together at once. Smoking, an unhealthy diet, obesity, the whole picture then greatly increases the risk of developing cancer. But still, I think it's interesting to ask, for example, what is the connection between obesity and malignant cell growth? Why is it connected? There are many claims being made, and here too, unfortunately, the exact mechanisms are still a mystery. But what you should know is that fat cells, especially abdominal fat, receive and send hormones that can lead to metabolic disorders, inflammatory reactions, and oxidative stress. All these can increase your risk of cancer. This in turn can promote tumor formation. It's important to note that I specifically said it can promote tumor formation. Unfortunately, obesity is something that our society has been struggling with more and more for decades, and more of us are getting fatter and fatter. It has to be said. Unfortunately, once again, the course for this is often already set in stone during childhood. This is a problem period, so to speak. Around 30% of 5 to 9-year-olds in Europe are considered overweight or even obese, an incredible number. And among adults, more than half suffer from overweight or obesity. Another incredible number. And that is something that is very important to mention, especially in times of discussions like body positivity. Therefore, and because obesity is also responsible for countless other potentially fatal diseases, including diabetes and many others, I get never tired of emphasizing it. And I think it's important. Reduce your weight gently and sustainably. When I say that, I'm not talking about body mania or some beauty cult. It is simply that you have a healthier yourself, so to speak. Cause number 4, lack of exercise. Do you also find it often difficult to get up for some exercise, or even to simply go out for a nice walk after a long day of work at your desk? Of course, that's understandable. We all feel that way. I also feel the same way. But you need to know, that lack of exercise is also one of the most common preventable risk factors for developing cancer. Every step counts. That is crucial. It is estimated that at least 6% of all cancer cases in Germany can actually be attributed to this. And it doesn't matter whether you are overweight and don't exercise enough, or whether you are of normal weight and don't exercise enough. This is actually a fallacy that many people unfortunately fall for. Of course, being overweight and not moving much are 2 different risk factors. But normal weight and little exercise is also not good. Little exercise is bad and another risk factor. People who do not exercise for years and do not regularly spend their leisure time in the fresh air are comparatively more likely to, at some point in their lives, develop bowel cancer, bladder cancer, and uterine cancer, for example. Here too, it is assumed that the positive effects of sport on the hormone balance and the immune system can actually counteract the development of cancer. So, looking slim on the outside, being fit, having no weight problems but then not doing any sport, still increases the risk of cancer. Incidentally, exercise also has a positive effect on the prognosis of cancer patients and cancer survivors. This is also important to mention. I also know that it is not always easy to combine regular exercise with a job and a family. Of course, this makes it much harder. But please do not be discouraged immediately. Even if targeted sports sessions are, of course, the most effective, it is also a fact that physical activity includes small, everyday movements that you can easily do during your day. This includes taking the stairs instead of the elevator, cycle or walk to work. Stand up briefly during work and stretch your feet. Walk around the block after your lunch break. Maybe do a little workout in front of the TV in the evening or something similar like that. Find things to get you moving. Anything counts. Cause number 5, infections. And you may be surprised to learn that it is actually infections that are estimated to be responsible for around 4% of all cancer cases. Don't worry, I'm not talking about a flu-like infection or the actual flu or anything like that. It's different from that. We are talking about infections with the so-called human papillomaviruses, HPV for short, and also infections with hepatitis viruses. HP viruses, in other words, the human papillomaviruses, are associated in particular with cervical cancer and oral and pharyngeal tumors. Also, penile carcinomas, anal carcinomas. Hepatitis viruses are logically associated with liver cancer. Of course, not every infection with these viruses necessarily leads to cancer. Many of us actually carry these HP viruses in us. However, they can contribute to genetic changes through various mechanisms, and thus they can cause cancer like that. Of course, an infection with such viruses cannot be completely prevented. It might always happen. However, you can usually prevent the infection quite well if you take care. For certain HPV viruses, which are mainly transmitted during sex, there are, for example, vaccinations that provide protection, which are recommended for boys and girls. And I have to say quite clearly that if you have not yet been vaccinated but are already older, you can still do it at 30 or 40. Unfortunately, nowadays you have to pay for the vaccination yourself, and it really isn't cheap. Of course, a responsible sex life, especially the use of condoms, is also important. This is common knowledge. Women also have the option of undergoing a cancer screening test. This is also done to detect an HPV infection as early as possible and to monitor its progress. What do you do then if you have an infection? You monitor the progression, so to speak. And it is very, very often the case that in 1, 2, 3, or 4 years, the preliminary stages of cervical cancer recede on their own. Between the ages of 20 and 34, you are entitled to this checkup every year, and from the age of 35, it's every 3 years. As you can see, there are a number of risk factors for cancer that you can actually influence yourself. You can really decrease your risk. And it is precisely the overall picture of risk factors, if they all apply at the same time. Then it greatly increases the risk of cancer. But it has to be said that there is no guarantee of not developing cancer. In brief, but broken down again by the most common types of cancer, lung cancer, for example, is easy to influence. Stop smoking. But you can still get lung cancer, also due to passive smoking. Bladder cancer is also easy to influence. Less smoking or no smoking, also no alcohol. Colorectal cancer, easy to influence. Prevention and diet play an important role. Skin cancer is easy to influence with prevention, sun protection. Uterine cancer is easily influenced with prevention. Vaccination is the answer. This list could keep on going. There are many types, but there are other cancers we can't influence. And unfortunately, these are often very, very dangerous cancers that we cannot influence, or where genetics play a significant role, and even early detection often does not protect us. When we talk about breast cancer, genetics and early detection can help. But for pancreatic cancer, certain brain tumors, blood cancer, we have little influence there. That is unfortunately also the truth. Nevertheless, as I said, and what is the main point of this video, we can reduce our individual cancer risk by avoiding risk factors. Thank you very much and stay loyal to me.